So the rule of thumb when making a retirement decision for an athlete is there's two main questions that you want to ask. One, is each concussion that someone is getting happening with less and less force? Meaning that they, first would take a nice big hit playing football and not have a concussion, but now it's like any little bump or shake, they're now getting concussed. Potentially, they've ended up in a period of perpetual vulnerability where they're not able to recover because they're always in that state of vulnerability that keeps getting them down and down and down. And now they're getting concussed easier and easier and easier. So that's question number one. Are they getting concussed easier and easier and easier? Question number two, each subsequent concussion that they've had, are they taking longer and longer and longer to recover? Symptomatically, this is. Because if that's the case, again, potentially they're in this period of vulnerability where these are actually cumulative concussions. These are not one-off concussions, but they've been mismanaged at some point, potentially, and now they're into a state where it's created this big problem for them. So those are the two questions that my go-to questions for anybody that's considering retiring from their sport. One, are you getting concussed easier and easier? And two, is it taking you longer and longer to recover each time you get a concussion? If so, then yes, you should be stopping contact sports. Yes, potentially you're in a vulnerable state that is potentially just getting worse and worse and worse and worse and worse. If the answers to those questions are no, well then there's some other questions that you would want to ask. And there's actually Davis Hayes et al. In 2018 published a nice little algorithm that kind of walks through a bit of a decision tree for the discussion to have with your patients about when to retire. And it goes through some of the absolute contraindications, like having structural abnormalities within the brain, Chiari malformations, that type of thing. And then it also goes into some other stuff in terms of focal neurological deficits, et cetera, et cetera, et cetera, et cetera. But it works through this decision tree. I think we could probably reference this in the show notes as well, so you guys can take a look at this algorithm. But I would probably use this as my go-to to help guide these discussions with patients when considering retiring from their sport.